Welcome back, deep divers. Today we're going deep into a book that might not immediately scream relevance to modern life.
Oh, I can already guess. Leviticus.
You got it. Specifically, chapter 15. But before you click away thinking, ancient rituals, who cares? Let me tell you, this chapter is surprisingly insightful. It's all about, well, bodily discharges.
Okay, not usually a dinner table topic, but I'm intrigued. How does that connect to us now?
It's about how ancient Israelites viewed hygiene, health, and community, and honestly, some of it's shockingly forward-thinking.
All right, you've piqued my curiosity. Lay it on me. What exactly does Leviticus 15 say?
So it gets into the nitty-gritty of what they considered clean and unclean, focusing on bodily discharges for both men and women. And it's detailed. We're talking specific instructions for washing, periods of isolation, even animal sacrifices,
Ha.
all as steps towards purification.
Wow, that's a whole system. It sounds intense, though. How do
Yeah.
they justify all that?
Well, it's framed in terms of ritual purity, but when you look closer, it almost reads like a public health manual, like separating people when they're unclean. Hello, social distancing, centuries before its time.
Fascinating. So even if their understanding of disease wasn't what we have today, they were onto something with containing it.
Right. It's like they stumbled onto disease prevention without even knowing about germs. And there's this underlying theme of protecting the community, not just individual purity.
Ah, so a very early form of quarantine, almost.
Exactly. And you know what's interesting is that this chapter tackles more than just illness. It addresses natural bodily functions too, like menstruation. No shame, no stigma, just a matter-of-fact approach.
Yeah, that's a message we still need to hear loud and clear. So Leviticus is about way more than just rules. It's about communal well-being on multiple levels.
Absolutely. It's like they were creating a blueprint for a society that could function even when faced with things that could, well, throw it off balance.
And that brings us to the question, how do those ancient ideas translate to the world we live in now?
That's what I'm dying to find out. From hygiene to public health to even how we view our own bodies, let's dive deeper into the modern-day connections to this seemingly archaic text.
You know, it's mind-blowing when you think about it, how these ancient rituals, like all that washing in Leviticus, kind of foreshadowed modern hygiene practices.
Right, like hand washing, such a basic thing, but it's public health 101.
Totally. And back then, they didn't have microscopes or germ theory, but the emphasis on washing everything from hands to clothes to the whole body, it points to this understanding that cleanliness matters for health, for community, for everything.
It's like intuitively they knew that keeping things clean helped keep people safe. And it wasn't just about personal hygiene either, right? That whole isolation thing that connects so strongly to how we handle things today.
Oh, absolutely. Quarantine, isolation, social distancing, the principle is the same. You separate people to stop the spread of something contagious.
It makes you realize some of these challenges, they're timeless, you know? And it's a good reminder that what we do as individuals, it impacts the whole community.
Big time. And that tension, individual versus the group, that's always going to be tricky. Especially now with how fast information and misinformation spreads.
Oh, for sure. Think about all the debate around vaccines or mask mandates. It's like we're still figuring out that balance that they were grappling with way back then.
And tech throws a whole other wrench in the works, doesn't it? We've got more info than ever, but that doesn't mean we're better at making decisions.
It's almost like we need a Leviticus for the digital age.
Mm-hmm.
Some guidebook for navigating the ethics of tech, especially when it comes to health and well-being.
That's a thought-provoking idea. But in the meantime, critical thinking skills are key. Being able to sift through the noise, figure out what's true, and make choices that are good for ourselves and the people around us.
It's like 21st century self-defense, but for your mind.
Hmm.
But speaking of well-being, Leviticus, with all its rules, it also emphasizes this idea of coming back together, reintegration, like welcoming people back after they've been isolated.
Exactly. It highlights that human need to belong, to be part of something. True well-being, it's got to include that social and emotional piece too.
Mind, body, spirit, the whole package.
Right. And I think that's something modern healthcare often misses. We focus on symptoms, but not always on the social or emotional stuff that contributes to those symptoms.
It's like we've lost sight of the bigger picture, that holistic approach they had going on back then.
And it has consequences. Stigma around mental health, the struggle to reintegrate after illness or prison, these are huge issues.
We need to create communities where people feel supported, connected, like they belong, no matter what they're going through.
Couldn't agree more. It's about recognizing that we're all in this together. Our well-being, it's interconnected. And that's a lesson those ancient communities, they seem to get that.
Even if their methods were, well, a bit different from ours. So we've talked about these big concepts, but are there real-world examples where we see this ancient wisdom playing out today, like in actual practice?
You bet there are. One that comes to mind is the whole movement around community health workers.
Now, I've heard of those, but honestly, what exactly do they do?
Okay, think of them like bridges between healthcare and the people who need it most. They're from those communities, they get the culture, the language, all the stuff that might make it hard to access regular healthcare.
So it's about trust, about meeting people where they're at, literally.
Exactly. And the impact is huge. They can help folks navigate the system, teach them about health, even tackle those social factors we talked about earlier, like poverty or housing, things that impact health but aren't strictly medical.
Wow, that's incredible. It's like a modern-day version of that Leviticus idea, bringing people back in, not just physically healthy, but part of the community again.
That's a great way to put it. And there are some amazing groups doing this globally. Partners in Health, for example, they've had amazing success using community health workers to improve health in some of the toughest places on Earth.
Man, that's inspiring. Proof that even when things are really tough, we can make things better when we think about health in that holistic way, the whole community.
It's about giving people the power to take charge of their own well-being. And this idea, it goes beyond direct care, too. Even public health messaging, like campaigns and stuff, that's got roots in those ancient principles.
Now, that's an interesting connection. How does Leviticus tie into something like a PSA?
Well, think about those rules for cleanliness and isolation. It was their way of communicating important health info, getting people to understand and hopefully change their behavior.
Like a Stone Age billboard. Wash up. Stay away if you're sick, and don't even think about touching that dead animal.
Exactly. The methods might have been simpler, but the goal's the same. Good communication is key to getting people to do what's good for their health.
And it's more than just facts and figures, right? It's got to connect with people, their values, their lives.
You got it. And stories, personal stories, especially about stuff that's been stigmatized, those can be really powerful.
It's true. A good story can cut through all the noise and make you feel something real.
They help us see ourselves in other people's shoes, build empathy and understanding, and that can lead to kinder, more supportive communities, which is what that whole reintegration thing was all about.
Man, this has been eye-opening. Who knew a deep dive into Leviticus would leave me feeling so hopeful about the future of public health?
It just goes to show even ancient texts can be full of wisdom that still applies today. And by blending those old ideas with what we know now, with innovation and all that, we can create a healthier world, a fairer world for everybody.
Well said. And to all our deep divers out there, keep questioning. Keep exploring those connections between then and now, because you never know what amazing insights you might find, even in the most unexpected places. Until next time, stay curious.